My name is Chelsey Wallace-Bawden. I'm a nurse practitioner here at Mineral Point Medical Center. I actually grew up here in Mineral Point. I'm married. I have two girls, and we live right outside of town. I've been a member of the Mineral Point Rescue Squad since I was 19 years old, so it's a lot of years now. I had to step down when we moved from the city out into the township. I did have to step down as first responder, so I don't quite do the hour requirements that some of the other members do, just because I'm far enough away, but still very active in it and still go on calls. So that's probably one of my main passions for community involvement and volunteer work. I also volunteer at the Catholic Church. I help do the catechism teaching. Primarily right now I'm helping out my daughter's class, which is nice. Again, I was actually going for pharmacy at UW-Madison. That was my goal, is to be a pharmacist. I had wanted to get involved and do some volunteer work, so I joined the rescue squad again while I was going to college, and patient care then just became my passion. So I just switched careers wholly, and I went to nursing. And I was a nurse at Upland Hills for 7 years prior to going back and getting my doctorate. So once I switched, it was just meant to be. I loved it. For me, it's really just knowing and treating the person as a whole. Kind of not only looking at them medically, but looking at them emotionally and mentally, looking at family dynamics. I think that's one of the best things nursing has taught me, is that medicine is only a very small part of our true overall wellness and health. So if we can make sure somebody is mentally, emotionally, physically healthy, truthfully, that's, I think, the epitome of health and wellness. Again, the nice thing about a small community is we get to see them out in the public. So, somebody we maybe caught something on, or, they were able to be saved, or they were able to go get the treatment they needed, seeing them walk in the parade, or seeing them down eating supper on a Friday night. It's just a really nice circle of care to see everybody in all aspects of life, not just treat them and then never see them again. It's just that small town care that's wonderful, I guess, again, and that it attracts me as a provider, it attracts me as a patient. I continue to come here as a patient, my family does, and I can't imagine going to any big city anywhere else.